All right, good evening, everybody. I'd like to call the November 7th program and budget meeting to order. And before we start, I'd like to read our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. With that, I'll take a motion to adopt the agenda. Motion by Commissioner Flynn, support from Commissioner Vosberg. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next item is the hearing of the public. Anybody from the public wishing to speak? You have 5 minutes. Anyone from the public? Going once, going twice. All right, seeing none, we will close the hearing of the public. Next item, 4A, request to approve the addition of children's waiver and serious emotional disturbance waiver contracts for provision of respite, nursing assessment, evaluation, and RN services to the existing fiscal year 18-19 specialty services contract with Health Call of Detroit, Inc. to be effective December 1st, 2018. Take a motion from Commissioner Birdie, support from Commissioner Flynn. Take her away.
Just a brief explanation on this one. This provider was already providing the OT and PT and speech services, and typically those do go hand in hand when you provide those services, that you would provide them under the straight Medicaid or children's waiver and SED, and they did not have that component yet added to their contract, and it was a request by a family, and that's how it got brought to our attention, that they wanted to stay with that provider, but had they were children's waiver. So we just wanted to add that to align them with the other OT, PT, and speech providers.
Any questions, comments? Kathy?
Just a question as to why wasn't it included before, and did they qualify all along, just wasn't included?
Yeah, when these contracts were developed, it wasn't standard to include that unless the provider specified that they want to also care for that service line. So they've kind of been added along the way as the providers have shown interest, or a family has said, I'd like to have this provider, and do they provide children's waiver or SED waiver? And so we've added them along the way.
Thank you.
Mm-hmm.
Thank you.
Any other questions? All right, seeing none, we have a motion and support. All in favor signify by saying aye. Aye. All opposed? All right, that is forwarded to full board. Next item is a request to approve the Procurement Review Committee's recommendation to offer a fiscal year 18-19 specialty services contract to 5 agencies for provision of behavioral health treatment, applied behavioral analysis, and those 5 are Health Call of Detroit, Marikey Midwest, Strident Healthcare, Total Spectrum, and University Pediatricians Autism Center. I'll take a motion. Support. Motion by Lou, support by Chris.
So this was the result of the RFP that we released in the summertime, and the procurement committee did meet and reviewed all of the proposals, and these were the top selected. These providers were able to evidence all of the things that we needed, such as they're already based in Macomb, they're able to start services more immediately, they had the credentialing process that we would want to see, they were fully aware of our policies, procedures, as well as mental health code and Medicaid manual, so they really were our top performers, and we were excited to have them have submitted for the RFP, so we're looking forward to onboarding them with your approval, and that they would begin to provide services immediately as soon as the contract's signed by taking at least 5 cases each, and then so on.
Any questions or comments? All right, seeing none, I have a motion and support. All in favor signify by saying aye. Aye. All opposed? That is forwarded to full board. Next item C, request to approve rate modification for contracted provider organizations specific to professional services and fiscal intermediary service. I'll take a motion to approve. Motion from Kathy, support from Joan. Go ahead.
And this is in regards to the previous discussion about our budget and where we're at. And this is a resolution to provide some relief and to align the providers. So you do also have enclosed the codes, the current rates, what the projected rate would be, and then where that would put us in line financially to see what the current cost is and what the projected cost would be. These providers have not had any type of rate reduction from Macomb in about 10 years, possibly longer than that. So we felt like these would be providers that would be able to absorb the cost. Nobody likes a rate reduction. Sometimes we do have to make these difficult decisions, but we would not want to impact providers that had cuts since the 2014 or 2017 cuts, and these were the ones identified.
Thank you. Any questions on this one? Kathy?
And we know they're going to accept them?
We've never had a provider to deny a rate reduction. I don't think that they're in the position to really do that, or that they would really do that. They may come to the table and say, for this particular service line, here's where we're at, and we wouldn't be able to absorb it. If that happened, we would ask for their financials, and we would review that with our finance and budget division and see if that's accurate, where are their expenses and things like that. We have not had that happen historically. If it does, we will bring in that provider and have a face-to-face with them.
And the new rates are comparable to other counties?
Yes. We also did review what the state averages were so that we would make sure that we were not putting somebody in a position to receive much less than they were elsewhere, and these rates would still keep in line. Some of our rates were a little bit higher than the state averages, so this is just bringing them closer to the state average, which was also made us feel a little bit more comfortable with this decision.
Linda?
How do they compare to our colleagues in the region, Oakland and Wayne, where we might share clients, or they could, decide that they're not going to serve Macomb clients because they can make more money on Oakland clients, and they can only have a capacity for so much?
I can't speak directly to each of their rates, and specifically Oakland has changed their payment structure, where it is more of a kind of, for lack of a better term, but per member per month type of a plan. But when their rates are recorded on that state report that shows all of the codes and all of the averages per county, and we were above them. So this won't put us, we weren't below them and now we're going even further below. We were above them.
And apparently, well, I would say apparently, they haven't heard of this yet, because they generally come to our meetings to address it. So this will be news.
Yes,
news.
it will.
Okay.
We have spoken with one provider about this face-to-face, but we have not spoken with the other providers as of yet.
Thanks.
Mm-hmm.
Any other questions? All right, seeing none, I have a motion and support. All in favor signify by saying aye. Aye. All opposed? That is forwarded to full board as well. Next item is D, request to approve a 9-month specialty service contract between Macomb Oakland Regional Center and Macomb County Community Mental Health. I'll take a motion to approve. Motion from Joan. Support from Chris.
Okay, so this is our MORC contract that we brought the extension to you last month, and we said that we would have you the 9-month contract this month and not in December. So here is the draft form. We have provided this to MORC. We did so on 11/1, which we did have a discussion with them, and that was the date that we had set that we would have a red line draft for them. We met with them today. We've met with them about 3 or 4 times actually since that meeting, and we met with them today, and we did go over the draft form. I think that we were in agreement at the end. We had a very productive discussion. There were a couple pieces to it that they'd like to see a little bit of word editing, nothing that felt too major to us, things that we felt like were appropriate or things that we can work through. There was one item that there might be a little bit more difficulty coming together in agreement on, but we did leave the room with an understanding that we are all there for the shared purpose. We want to have a signed contract on 1/1. And so really at this point, with the additions that they had or the changes they had, we would put it to you with how you feel about the language. Would you like to see us put those changes in and bring it back to full board, or would you like to see an addendum just highlighting each of those changes? And I think both parties felt comfortable with either of those routes.
Any thoughts on that, commissioners? Joan says it sounds good.
Okay.
What sounds good? Do you want the addendum, or do you? No, it sounds good. Any?
It's a major contract.
Right.
Yes, sir. That is why during the meeting today, I had suggested if Mork was comfortable, perhaps we could let this one go forward so we don't get past our deadline and create an addendum that would highlight the changes. We can work quickly to do that and get that back to Mork, make sure they're comfortable, and then bring it back with just an addendum to full board, or again, to defer to your opinion if you'd like to see it all put together for December's program and budget. So to your interest, we can move quickly on it.
Any other comments or opinions? Kathy, go ahead.
The motion right now is to just approve it as it is.
Correct.
And I say let's stick with it. If they bring some kind of an amendment or addendum to full board, we can consider that.
Sounds good to me. All right, we have motion and support. Any other comments or questions on that? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Let's go into full board. Next item is item E, request to approve rate modification for contracted provider organization specific to behavioral health treatment, applied behavior analysis. Take a motion to send that to full board. Motion by Linda. Support from Kathy. Okay.
So similar to the primary clinical providers and the fiscal intermediaries, this would be a 6% rate reduction to the providers listed here. You also have an outline of what those providers are, the codes, current rates, and projected rates along with cost. And this is put into effect. Their payment structure from the state is changing for these services, and we need to come in line with what the state will be paying for us to provide and to make sure that we are not going over budget. And this rate reduction will allow us to stay within the allotted amount that we will be given.
Any questions? All right, seeing none, I have a motion and support. All in favor signify by saying aye. Aye. All opposed? All right, that item goes to full board as well.
Thank you.
Next is, thank you, is item F, request to approve contract with professional consulting services. I'll take a motion to approve. Motion by Chris, support from Linda.
I'm gonna, if you want an update on it, I can defer to Jim on it. Jim's gonna run this one.
Sure, brief update wouldn't hurt.
Sure.
Thanks, Jim.
Yep, this is a extension of the contract that we signed in June regarding the services that we provide on behalf of this professional consulting services to offenders that are coming out of prison prior to them receiving entitlements such as Medicaid. So this professional consulting services will pay us for those services according to the rate schedule that's attached. One thing I do want to note is that in my haste to get this board item on the agenda, or this item on the agenda, I grabbed the contract that was signed by the executive of PCS and our executive, and I did not grab the one that had the county executive signature on it. I do have the copy that has the county executive signature on it. So we did follow the process and get that as well, but I grabbed a earlier version. But this is just a renewal of that contract that we did in June related to the provision of services for offenders.
Thanks, Jim. I was going to ask you about that signature. Beat me to it. Any other members have any questions for Jim or comments? All right, seeing none, we have a motion and support. All in favor signify by saying aye. Aye. All opposed? All right, motion passes. That's on to full board as well. Next is item G, request for approval of agreement between MCCMH and the Michigan Department of Licensing and Regulatory Affairs for access to the PMP, which is a prescription monitoring program gateway service. Motion by Lou. Is there support? Support from Chris. John, is that you? Or is that Jim again?
Jim again.
Come on, Jim.
This is an electronic version of the MAPS program, which is a tool that is available to allow us to monitor controlled substance prescriptions. So we can look to see if someone's doctor shopping for controlled substance prescriptions. This is something that can be incorporated into our EMR, and the state will cover the cost of that integration until the end of August 2019. So we'll be able to get it integrated so that physicians can use that to check on the prescription of controlled substances.
Thank you, Jim. I think it's a great idea. Any questions or comments on this item? All right, seeing none, I have a motion and support. All in favor signify by saying aye. Aye. All opposed? The motion passes. Next is item H, approval of residential lease A. I'll take a motion to approve. Motion from Joan, support from Lori. Any questions or comments about this? All right, seeing none, I have a motion and support. All in favor signify by saying aye. Aye. All opposed? Who opposes? Motion passes on to full board. Next is item I, approval of residential lease B. Take a motion to approve. Motion from Joan. Support from Lori. Any questions or comments on this item? All right, seeing none, I have a motion and support. All in favor signify by saying aye. Aye. All opposed? Who opposes? Motion passes on to full board. Next item, J, approval to contract with Care of Southeastern Michigan to deliver specialized outpatient treatment and recovery support services for older adults suffering from SUD addiction. Motion from Joan, support from, is that Linda? All right.
Yeah, good evening. I'd like to introduce Monique Stanton, who's the director of Care of Southeastern Michigan. I think many of you know her, so she gets around. But she's going to talk more specifically about what it is that we're looking for right now. You know, we are looking to contract with Care of Southeastern Michigan to do an outpatient older adult program. And you know, it's something that we've been trying to do for the last 6 years. We listed it as a priority in our RFPs, and we didn't get any takers. So finally, Monique stepped up and said, well, yeah, we'd like to do that. And I said, great. So I'll let Monique come in, and she's got a short presentation. You get to see it on your monitors, I guess. We have to look back here.
Good evening. Thank you for the opportunity to present today about our proposed older adult treatment and peer recovery coach programming. For those of you that are not familiar with CARE, we have been serving the community since 1977. We impact the lives of 40,000 people or more each year in our prevention, substance abuse treatment, peer recovery coach, parent education, and employee assistance program. So we have a very wide and deep reach both in Macomb County and in the surrounding area. So a little bit of a snapshot about some of the needs in the community regarding the aging population. Approximately 16.2% of our population in Macomb is over the age of 55. When we look at population growth in our community, there has been primarily significant growth in those that are over the age of 55. We do project that seniors will outnumber children in Macomb County by 2025. That is trending much faster than the rates throughout the rest of the nation. As Randy mentioned, services to the older adult population in the community around substance use disorders has been an identified gap for quite a few years. And what we're really looking at right now is supporting individuals. We expect there's going to be two significant primary problems. One, while we do face an ongoing opiate epidemic, we recognize that older adults have high rates of opiate use, often high rates of multiple different types of drug use, but also alcohol abuse and how that could be interacting with other medications. And so what we're proposing to do is really provide home-based and intensive treatment and case management services. We are looking at doing coordination of resources, and including coordination with physical health care, ensuring that the senior person does have access to high-quality health care, and it's coordinated with their behavioral health needs. We're looking at doing interventions to help rebuild family relationships. We're focusing on connecting people to supportive services and connecting individuals to socialization activities. We expect that a high number of people that are participating in the program will be isolated. They may have burned relationships with family and friends, and we want to get them connected to other supportive services. We're also, this is one of our innovative approaches, we're looking at hiring a peer recovery coach specifically to work with the individual. So when the person may be done with formalized treatment, they will still be able to have that connection to a peer recovery coach. And then we will provide transportation, help coordinate transportation with other services, provide it directly by our staff, or use our Uber Health account when needed to help get people connected to care. In terms of identifying individuals in the community, we have a wide range of community partners. Specifically, we'll look at Community Mental Health Access Center for referrals. We have a successful peer recovery coach program located in 4 emergency departments. We expect to get referrals from there. We have partnerships with senior centers, and we also will work very closely with Macomb Community Action, Meals on Wheels, the Injury Prevention Program, and also churches. In the pilot phase, because this is a very intensive level of service, we expect serving at least 45 people initially, and up higher numbers as we get the program started and fully implement the services. For staffing, we're looking at hiring 2 full-time staff. The first will be a master's level therapist and case manager. They will be a licensed individual and get the CADC. We also will hire a peer recovery coach. They will be trained through either the required state peer recovery coach training or the CCAR training, which is the Connecticut Community on Addiction training. And then through the Michigan Certification Board of Addictional Professionals, we'll have that person certified as a peer mentor. And then the outcomes for the program, we do very much believe in strong evaluation. We will use the federal standards of the national outcome measures with a specific focus on reduction of past 30-day use, and also focusing on growth and improvement in the self-sufficiency matrix. This is an evaluation tool that measures 19 life domains, including income, access to elderly care, housing, food, income, really what an individual needs to be self-sufficient. So we are requesting $152,900 to support the program. And if we have any, do you have any questions?
Linda?
This is a great idea, and I applaud the contract. At the substance abuse conference, one of the pre-conferences was on this growing population that older adults are increasing the number in addictions. But my question is for Macomb County, is there an income eligibility for this contract? We used to be able to like service people if they didn't quite meet Medicaid, or when these people would be on Medicare, many of them, through general fund. We don't have that anymore. So will people not be able to participate because of income eligibility?
So it would be based on any of the other type of income for any other federal PA2 dollars coming into the substance abuse care. So it's typically lower income individuals, but it could be Healthy Michigan, Medicaid.
So it is not just Medicaid, it's Healthy Michigan too. Okay,
Yep.
Thanks.
Joan?
Who's paying this $150,000? Randy?
You are.
No, you are. Is this coming out of substance abuse?
Yeah, this would come out of our Public Act $2. We've got sufficient dollars to pay.
Where the money's coming from?
That's where it's coming from.
Well, we can use a lot of your money. And I know Monique, she does good work.
Pardon?
CARE does good work.
Oh, yeah.
Great. Thank you, Joan.
Kathy?
Thank you. Monique, I heard you mention Uber for is that a dedicated Uber, a trained dedicated Uber
So we use an Uber Health account, so it's HIPAA compliant, and so it's not an Uber driver on behalf that drives for care, but we can set up transportation using Uber if necessary to get somebody to go from point A to point B. We'll also work with Logisticare and other services. We don't use that all the time, but something that we use to fill the gaps.
so-
And then staff also can provide direct transportation to an individual.
Okay, so it isn't just anybody off the street with a car picking up
Correct. No,
somebody.
it's all through the Uber HealthLink
All
account.
right. And then you had also mentioned you're targeting starting with 45 people. You have capacity for 45 people. I wonder how'd you arrive at that number? And then a question of Randy is 45 sufficient? Where does that fall in what your perceived need is?
Well, we're really seeing this as kind of a pilot project because we don't really know how intensive it's going to be and what it's going to require. We do know that most of the clients that we're going to be seeing there are older, have much greater needs than most of our other clients. So we're kind of estimating low and hoping it goes higher. I also think we look at it as a pilot project now, so we're going to learn from that. But I fully expect that we're going to continue this beyond that because, people aren't getting any younger out there. And, I want to make sure there's a place for me when I need one.
Right. Is
I don't
the
want to talk about age.
how will you get the referrals to this program, or do you already have enough people that you know to
Well,
sign up?
You want to talk about Marcia?
Sure.
Yeah, Marcia's a real good source. And
So we have been providing substance abuse prevention services and education services to the aging population and caregivers for, I want to say, at least 15 years, if not longer. And so we have strong relationships with a variety of senior service organizations. We have good partnerships, and so we expect that we'll be able to start promoting it relatively quickly. We'll get referrals from the senior services through Macomb Community Action, from faith-based groups that we work with, and then I also expect we'll be getting some referrals from the hospitals that we're already working in.
Great. All right, thank you.
You're welcome.
I have a quick question. So you said it's a pilot program. Is CARE partnering with, Oakland or Wayne, or is this strictly us right now? We're the sole pilot program?
We're the sole pilot program at this
Tongue
point,
twister.
right?
Okay.
Yeah.
Okay. And then in the future, is it possible to get grant dollars to fund a program like this? I know this is sort of in the beginning stages, but looking ahead a little bit.
So part of what we've done in terms of determining the type of staff that we want to hire and the licensing and credentialing background is that we want to be able to pave a way that we'll be able to bill insurance or Medicaid for the services.
All right, thank you. Any other questions or comments? All right, seeing none, we have a motion and support to approve the contract. Randy, do you want to?
Oversight Policy Board approved it, or recommend approval today.
Perfect.
So I'll
Thanks for the tidbit. All in favor signify by saying aye.
Aye.
Aye. All opposed? All right, motion passes on to full board. Next item is a receive and file. Receive and file MDHHS OROSC State Opioid Response SOR Grant Awards. We'll take a motion to receive and file.
So moved.
Motion from Chris, support from Joan. Take her away.
Okay. I guess while you were sleeping last month, we got an extra $1.6 million from the state. This represents federal dollars that came down. Remember, last year we added into our system about $1.3 million of state dollars, or I'm sorry, of STR dollars they called it. This is the second round of that. It's similar. It still targets the opioid population, but the initiatives are all different. So they spent 2 years it hasn't been 2 years yet, but it's about a year and a half now, in establishing some new initiatives and trying to get things going. And as of April of this year, that money will be gone and those initiatives will be gone because they won't be supporting it anymore beyond that. Although we are supporting all of it through the end of the fiscal year and then determine which ones we want to keep from that point. We got $1.6 million, but that's for 2 years, so we get $8 million. The state received $27.5 million. Last year they got $16 million. And this year, the They only put out $8 million to the PIHPs. The rest were all out on other specialized kind of initiatives. Actually, the majority of it went outside. But so they're getting $27 million for 2 years. So that's $54 million versus what was $32 million before. And these will go from October 1, and they go through the end of September 2020. So it's a 2-year grant, but they already told us that they're not starting up until December. But we'll get our full 2 years worth of cash. So it won't be exactly for 2 years. But I have for you, here's a summary of all the different services. The state pretty much defined what categories and what could be done within those services, so it was pretty limited. We had a total of about 2.5 to 3 weeks in which we got to, they told us, this is how much money you're getting, this is what you're giving in each category, give us a proposal within a couple weeks, and that's pretty much what we did. And based on that, the first one they gave was to, they mandated that the initiatives had to have a grant coordinator to oversee the grant for the 2 years. We didn't have that on the STR, and we paid for that statewide because, you know, there's a lot of new initiatives coming up, and if you don't have people that can oversee it, you know, it's not as successful as you want to do. So that was the first one, which we were glad to see. Another area was in the area of prevention, and they came out there. We had a choice of about 3 or 4 different categories in which we could do. We chose Prime for Life, which is really a high-risk kind of a prevention activities for young people, for people that might be involved with the juvenile system, folks like that. Macomb Family Services will be providing that for us. They're the ones that also did the prevention initiative they had on STR. Similar stuff, but not the same, so we couldn't do it the same. You know, really would have been better to be able to extend what we started with, but that's not always the way things work. The other one was, now this is one that is similar from last time, was the overdose education naloxone distribution. You know, we've been doing this since 2014 at the STR initiatives that we did. We had Clinton Counseling do the NOPE. They came up with the NOPE program, and they're educating the public, and they're also, you know, distributing the Narcan and some kits, related kits to that. They just don't reach a very large population. I think they got about 350 last year, so they gave us extra money for this. FAN has also been doing some education programs and distributions for Narcan. They put in a proposal. We're agreeing to do that. We're recommending that we do that. And then FAN has a unique population, as they've already talked about, by, you know, you've got the recovery coaches that can go around into the hospitals. We're asking them now to go into the hospitals. They're going to go into the FQHCs and going into the, you know, some of the other, I'm blanking on the word, but, you know, urgent care centers to do. So they have a unique opportunity to pass things out individually and deal with folks individually. So we've got we'll have 3 different methods of doing it. And the goal is to get it out there as much as possible, especially for for high-risk folks or family members of high-risk folks, so that they could deal with that. So, so that's what that one is. Peer recovery coaches, I just kind of mentioned this in an outpatient setting. Again, you know, they did it last year with the STR. They did it in the emergency rooms of 3 different hospitals. And now they're asking that they do it in a different setting. So we're looking at FQHCs, and we're looking at doing it to the urgent care center. I remember it at that time. So we're finding other venues in which they could provide those same services. I don't know if there's anything else I want to say about that. The other 2 that we're looking at is the medication assistance treatment at the Macomb County Jail, and this is one that's well needed. We've talked about it in the past. Weren't able to get anything started on this. They initially gave us $75,000 to start a program at the jail, to which we said that's not enough money at all. They had dollars in there for some other purposes, such as to try and cover people that don't have the resources to pay for services. And we said, we were able to provide services for those that don't have the resources with our PA $2 and our block grant dollars. Could we do more? So they gave us another $200,000 so that we now have $275. So we'll be doing that. Sheriff Wickersham was very receptive to do that. You know, we've got a lot of details to work out, but Sacred Heart has done this. They've done it in Oakland County, and I think they've done it in Flint, somewhere else. So they've got they've got a model that's set, that's worked in other venues that we can bring it here. So that's got a lot of possibilities as well. And then the other point, is the opioid-specific recovery housing. We have a number of, we have 25 or 26 recovery homes in this area that we contract for, but there's only one provider that will see people that are on methadone or on Vivitrol or on Suboxone and the MAT clients. And those are becoming more and more part of our system, and we need to find somewhere where they can go because they have the same they have the same needs that everybody else, the housing needs that they have. So we've asked the ones that we got, and we do, and nobody wanted to take this on. So we decided that we would contact Sacred Heart because we knew that they had a recovery home out in Port Huron, and they've got another in a couple other places, Benton Harbor, and they agreed to do it. So what the plan is here is that they will seek to find 2 homes, one for males, one for females, and then they will manage that for us. So we were fortunate that they got that experience because it'd be hard to find people otherwise. And then the last thing that's on here is a Government Performance and Results Act. That's $20,000 per year. And that's basically a reporting mechanism that the feds require anytime you do clients. And the only 2 that it applies to is the 2 that Sacred Heart are on. So that makes it nice and easy. So we allocate the money to them. And that's that. I found, I didn't see it right away, but we had another $52,000 that they just dropped in at the bottom of the allocation letter that they sent us. That's for employment services for kids in the ages of 18, 25-year-old zone. So I need to find out more about that. We did meet with somebody for a short while last week, but that's another piece that they just kind of gave to us. So that seemed to be happening more than it has in the past, but nice surprises. So anyways, that's pretty much what I got. It all came in before we had a chance to run this through, which is why it's a review and file for tonight.
That's fine.
Yeah,
Keep the money dropping in.
Yeah. Yeah, well, I've been around long enough to know that doesn't last all that long.
Yep.
So we appreciate it when we get it.
Joan?
So they give you all this, money, and you put it in all these different places, or do they tell you where to put it first?
They gave us a category, and they told us how much money would be in there, and then we had to go within those categories, and then we had to make sure the money fit. If the money didn't fit, then we would make an argument as we proposed it, like we said about the MAT for the jail program. We were able to shift money around. We couldn't get more money, but we could shift it from one category to the next.
Okay, thank you.
You're welcome.
Any other questions or comments? All right, seeing none, I have a motion and support. All in favor of receiving and filing, say aye.
So moved.
Aye. All opposed? All right, it has been received and filed. Thank you very much.
Thanks.
All right, next is resolutions. We have none. Item number 7, other agenda items. John, you want to kick this one off? Or do any other board members want to kick it off?
No.
Okay, John first.
Thank you, Mr. Chairman. I put before you today a memorandum. It's pretty straightforward. I think the board should be looking at future opportunities to continue to preserve the healthcare, behavioral healthcare system here in Macomb County. We have a work study session scheduled already for November 29th. I'm simply proposing that we cancel the 29th session through the board chair and reschedule for December 5th in the morning. And at that point in time, review these documents that I provided in this packet for you, many of those documents that you're already familiar with, to provide you with a brief update on my meeting with the department last week, and also to invite and welcome a national healthcare agency to talk about, opportunities for, public-private partnerships. It's a non-committal, no-cost dialogue. I think it would be valuable for the board to hear, what's out there in the marketplace. So I'm looking for, again, through the board chair, to move the meeting from November 29 to December 5.
Anybody like to make that motion to move it?
Was it okay?
Yeah,
I'll make the motion to move the workshop
Motion
to,
by Joan,
December 5th at 7:30 to 9.
So, maybe a little bit longer meeting, 7:30 to
9.
9:30 or so. Yeah, could be a little bit longer meeting.
7.
But, I would encourage the board to take a little bit more time and not to rush this one.
we'll just say 7:30 to 10.
7 instead of 7.
We'll say 7:30. Lou?
Pardon?
Thank you, Lou. John, was there a reason for moving it to the 5th?
It was originally, or we tried to set it up for the 29th, but the folks that were having come in as our invited guests also have a board meeting on that date, the 29th, and they can't make the 29th. So they offered up the 5th. And so I proposed that for you. And if that's not going to work, then I'll defer to the board on how you want me to proceed.
Thanks, John. Linda?
John, do you have specific companies? Apparently you've set the date, so how are they who are they, and how, you don't have to say them if you don't want that. Whatever.
What I mean.
But
They
how are they
don't.
selected? How are they selected? Who you've invited on the 5th? Because when we were in Traverse City, there were a number of companies that were around the conference and so forth. So how were these selected? How many? It's only an hour and a half meeting, so it can't be a number of them.
Well, again, I had a meeting with 2 companies, okay, and I have one on the hook now for December 5th, willing to come in, and today I'm trying to get the other company to also come in to, again, and this is just for dialogue, for the board to have a better, more thorough understanding of, the current marketplace, potential opportunities for future marketplace, transformation. It's a big word, but let's look at what's available to us. And there's no commitment in the coming months. I think the board is going to be positioned and required to do some real busy work real quickly, to consider. I'm not trying to sell public-private partnership right now, but I think you ought to consider that, and I'll explain why you need to consider it, and you need to do so quite readily. Not to be an alarmist, but I indicated that you need to do it quite urgently, and I just have 2 companies that I bumped into, so no commitment to neither one of them.
What does bumped into? You didn't mean bumped into, like not in a hallway or anything. That you've researched them.
You were there.
Okay.
I bumped
saw you
into
bump
them.
into them.
I bumped into them. They're informational agencies that are going to be able to, I'm not saying you want to select anybody to go with. I think that's way too premature. This is just informational.
So to,
Yeah.
We're not being committed.
Kathy?
So, yeah, to the date change, I know we spent some time trying round robin, trying to figure out dates for these work groups, and we set those to the best that we could. And I appreciate, Loula, your willingness to even show up for part of the time. That would be great, because I think the idea is we're not going to solve anything. We're not going to make any recommendations. We're just basically starting to get information. So as much as you can, gather while you're there would be appreciated, because you have the experience with the board and with statewide community mental health that a lot of us don't have. So if you can be there for part of the time, that would be great.
Well, I'm not sure I can adjust the conflict.
Right, but I thought I heard you say you could maybe come to our meeting for part of the time, but you'd have to leave early.
I'd have to leave at 8:30, 8:45.
Okay,
By 9:30, which is the conflict if I can't move it.
sure.
I'm just telling you that ahead of time.
Yeah, I appreciate that. But I think an hour, we should get some good information within that first hour.
Except that I hear John is introducing these people later than that, so I would obviously miss it if I can't make the adjustment. You know, the reason we give dates ahead of time is so that we can clear our
Is your mic on, Lou?
29th, but
Right.
Do you have your mic on?
pardon?
Your mic?
I'm sorry. I said that obviously cleared the 29th, but the 5th, when I made the appointment, I didn't have any CMH conflict. Now there is, so I'm stating I may not be able to adjust it. I will try Friday to make that adjustment. That's the earliest I can try and do that.
Thank you.
I'm gonna leave.
All right,
early,
thank
too.
you. And the reason, again, nobody's gonna, none of the groups can come in on the 29th. There's the one that can come in on the 5th and possibly the 2nd.
December 5th, what was proposed to me, and if we can't agree on that, then I would have to go back to the drawing board with them.
Can you
Okay,
make-
well, we have a motion on the floor for December 5th at 7:30. It has not been supported yet, but there is a motion. Okay, support from Linda. And all in favor of December 5th at 7:30, say aye. Aye. All opposed? All right, December 5th at
I'll just leave.
7:30.
Right, and one other comment too, I'd like to move that meeting to the Community Care Center down on 15 Mile Road, because I'd also like the executive and senior staff to be participatory in the discussion as well too.
Kathy's making a face, but I think it's okay.
Just longer drive time, that's all.
That'd be fine, John.
Oh, poor things. It's good for me.
You have anything else for us, John?
Important now.
All right. Just a reminder, Detroit Wayne is hosting the next Tri-County Metro Region meeting on Thursday, November 15th at the Garden Theater,
Are you going?
which is at 3929 Woodward Avenue in Detroit. So mark your calendars for that. Anybody else
You need a vote
for what?
for
Do-
this meeting?
You want to vote to go?
Whether we're there or not.
Yeah.
Okay. Well, this is pretty classy.
Just dress up, Joan. I said just dress up, Joan.
Yeah, I'm-
Any other board members have any other items for the good of the board? Linda?
Last week, Lou and I were the two board members who attended the exit conference at the administration building for the review that the state of Michigan did for recipient rights.
yeah.
And I think we were all just so happy. Out of 194 possible score, our Office of Recipient Rights received 194 points.
Oh, great.
Yeah, you can applaud that. There were a number of things that they said that how the county just really was a shining example. They even asked if there would be an opportunity for a couple of things, for Macomb to be noted around the state in some best practices policies, and also even to do some training, and for other counties. They set a score like we got. There's one section, section number 7, complaint resolution content in the, said usually it has very low scores all across the state, and ours was at the highest standard. So they went on and on and on through the whole thing. Every single point was addressed by our recipient rights. So I think the board can take great pride in the work that Mark and his staff does on behalf of us and our consumers.
Excellent.
They also loved, we've had a lot of discussions about this, they loved that we hear all of the appeals and that they aren't mediated. I text our chair on that one, that we didn't mediate them away. And that I'm reading some of my notes, site visits were done as well as they could ever be expected to be done. So it was high praise. John was there. I think Jim was there too.
Thanks for the report, Linda. Lou?
Piggybacking on Linda's comment, what is really significant is that 194 is a perfect score. It's the second year in a row that it's been a perfect score. And the comment that they made, that the larger the program, and we have the largest program in the state, in particular to the amount of complaints and attention to the complaints, that the largest program, it's very, very difficult and close to impossible to score a perfect score. So I think Recipient Rights and Mark's people ought to get a attaboy in the sense that it's twice in a row, which is almost incredibly impossible.
Thank you, Lou. Any other?
Are we doing
And they
something?
complimented his warm and fuzzy letters, which I think Mark took personally.
Thanks, Lou. Any other comments from the board? Any other items? Jim, anything? Perfect. All right. With that, we'll close other agenda items and we'll go to hearing of the public. Anybody from the public wishing to speak? Going once? Going twice? Everybody's looking at each other. Nobody's getting up. All right. Going thrice. We're going to close the hearing of the public. And with that, we will adjourn tonight's meeting. Thank you, everybody.